Trauma Team Alpha, Emergency Department.
55-year-old female, fall from a horse, drug around the corral.
Sharon, wiggle your toes for me. It hurts?
I have minimal pulse up here.
Call the ultrasound tech and tell them to come now.
These are stories of real people.
We participate in people's lives when they're at their most vulnerable, when they're frightened. We share those moments with them and ease them through that time.
You know I trust you with my life.
Patients don't realize that they have this ticking time bomb.
He says, you probably won't get to the hospital if that bursts.
I always saw myself as a family man, get married, have kids.
Fertility levels fall after spinal cord injuries.
I've been on the chair for 29 years.
There's been a couple times where my grandma thought that it was all gonna end.
Prognosis is you live about 5-6 years.
She's in need of a transplant, and we all pray that she gets that in time.
These are stories of the Sharp experience.
Sharp, Medic 17, gonna have a trauma for you guys.
Go ahead, please.
55-year-old female, like approximately.
Trauma Team Alpha, Emergency
Fall
Department.
from a horse, drug around the corral by the horse.
She came to us with injuries that are potentially life-threatening.
The whole process of healing starts the minute they come into the trauma room. Right away, the best thing you can do is control their pain. You're flat on a board, you've just took a helicopter here, and you're rushing into a trauma room, and you've got 8 or 9 people grabbing at you, cutting your clothes off, covering you with blankets, putting in IVs.
We call up to the OR.
We always, right off the bat, say, this is the trauma team. We're here at Sharp Memorial Hospital. We're going to take care of you. This is what's going to happen.
It hurts so bad. I'm Dr. Belezzo. Hang on one second. I'm Dr. Belezzo. Okay, Dr. Kill's going to be with you in just a moment, okay?
Was dragged around a corral, hitting cement post all the way around, 3 times around. Husband reports that the helmet came off during the event. She has trauma to her left abdomen and left chest.
X-ray, come over here. Hon, what's your first name? Sharon, wiggle your toes for me, hon. Squeeze my hand. Good. Okay, just... Okay, sweetheart. How about your belly? Hey, Sharon. Sharon, I want you to bend your legs, hon. How about this leg? Bend this one. Why can't you bend it? It hurts? Okay, slide inspector. Joe, hold off on the intubation. Get ready. No problem.
Get some stuff done, okay? Sometimes just whispering to a patient, this is what we're doing, I know you're in pain, is the most comforting thing. Holding their hand.
That line's working great. It's working like a champ.
Okay.
I hate to tell a patient you're going to be okay because sometimes things can completely turn around and it's hard to regain trust. That's a definite no-no.
We have no vital signs yet, guys?
93 over 52 blood pressure.
She had a low blood pressure, she had a high heart rate, and in the setting of trauma, that can only mean blood loss from somewhere. So the next step is to figure out where that bleeding is and stop it.
Call the ultrasound tech and tell them to come now. Get on their way.
When you have a patient with abnormal vital signs that are consistent with bleeding, yet there's no outward signs of bleeding, we use ultrasound at the bedside to determine where the bleeding's coming from.
That is positive.
We found that she had had a spleen injury.
She's got fluid around her spleen.
Is the OR ready?
They said come up whenever we need to come up.
I have minimal pulse up here.
Oh, come on now.
Do 20 of etomidate, 50 of rock. As the ER doc, one of our specialties is managing the ability of the patient to breathe. That leaves the trauma surgeon the freedom to assess all the other patient's injuries.
She's got a left-sided superior inferior pubic rami fracture. She's got a massive iliac wing fracture.
You can lose a whole body's volume of blood in the pelvis. There we go. Back, 1, 2, 3.
Okay, lock it down, lock it down.
A pelvic binder is this contraption that goes around her pelvis and wraps it tight so that those pelvic fractures that are now open and bleeding get pulled together so that the bleeding will then stop.
Call the OR, cover her up, we're going. Who's got level 1?
She is going to the operating room under the care of the trauma surgeon in a situation where she needs an operation that will save her life.
Go, 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 go. Let's go, let's go.
She knows horses better than anybody I know. 25 years ago, we would go ride together, ride down the beach together. It was great. Great horsewoman. The horse spooked, took off, and then he planted his front feet, and Sharon went through the reins. So when she hit the ground, she was being dragged by the reins and the lead rope. And the horse started to drag her, and he dragged her around the arena, all the way around, probably 3 or 4 times. She had both hands like this to stop from being hung, from being strangled. And every time I tried to make it stop, the horse would dive around me. What he was doing was throwing her this way and this way, like at the end of a whip line. That's when she hit those concrete posts. It was a really bad sound. It was horrible. It was really horrible.
I need a clip applier, medium and large.
We removed the spleen, and she had a ruptured stomach. She had about a 6 by 4 inch blowout of the back of her stomach.
We're still giving O negative.
We used a combination of suture and surgical stapler to close the hole in the stomach.
Give me a suture.
I paint a very realistic picture to families and give them the whole range of what can happen.
I don't remember his exact words, but he communicated, this is as serious as it gets. There was a chance that she could die.
I knew inside there were major things hurt. I didn't see a way that this was going to end, except with dying. Truly, I didn't.
I have to give you a hug. You look absolutely wonderful.
You know what you should do for a living? What you're doing.
Our work is very personal, and that makes it emotional. We take these people home in our hearts, we take them home in our minds, we think about them when we go home.
It's a blessing, a miracle. I look at him like, oh my God, you look wonderful. Because the last time I saw you, it was pretty bad. And to see you now, up and walking, that's what make me cry.
When patients come back to us, they don't realize the real gift is just seeing them. Everyone who does this job loves it. The pride you feel in what you do, the feeling of accomplishment, returning people to their hopes and dreams, to their life.
There you go. Come on. Good boy. It's been a while. That day, I did everything wrong. I just skipped every one of my own rules. And went, you know, from A to Z. Good job. None of this is Harry's fault, the horse.
When she finally woke up, I had a feeling that it was going to be okay. You know what? She's alive. That's as perfect as you can get. She's alive.
If you don't understand what life is about, you can sit by a horse and you'll figure it out.
There's a little thing that goes on between Elizabeths that are called Bettys and Bettys that are just Bettys. Real Bettys are sassier. In my yearbook, underneath my picture, it said spaghetti legs because I played basketball until I couldn't even stay up on my feet anymore. I put everything into it. This tells you a great deal about me.
All righty, Miss Betty. Now, come on back with me. Yep.
Every 2 years, I get a chest x-ray. The doctor had called me up and said, Betty, did you know you have an aneurysm? I said, no. And that was about 5, 6 years ago.
I'm gonna put an IV in you now.
So I have good veins, too.
My gosh, put a hose in that one.
Most patients don't realize that they have this, what I usually refer to as a ticking time bomb.
But they are little time bombs, you know. They could go off any time.
When it ruptures, you have seconds to live.
Dr. Terabani says you probably won't get to the hospital if that bursts.
When the public hears aneurysm, the first thought that goes through their mind is brain aneurysm.
I have 2 aneurysms.
Are you warm enough?
One is aortic, which is right around your belly button. The other one is iliac, which is buried in your pelvis.
Abdominal aortic aneurysms are a breakdown of the artery, and it becomes weaker as it dilates bigger and bigger.
She's very photogenic.
It's exactly like inflating a balloon. You can get it to get bigger and bigger, but there gets to a point where it can rupture. People lose consciousness, they have a heart attack, and then they die.
It's not important to me to live for a long time. I'm a poster child for quality of life.
There you go.
Thank you, Margie.
You're welcome.
I've been so active all my life. To take that away from me would be to take away part of my soul, I think.
How are you doing?
I'm doing fine. How are
Nice
you?
to see you.
Nice to see you.
So I have your CT scan results. And your aortic aneurysm's still small. Your iliac artery aneurysm is the one that has changed.
Oh, okay.
So it's over twice. It's about 2.5 times size normal.
You know, you live with this for a while and nothing's happening, and then all of a sudden, oh, okay, it's time we do something.
The traditional way of fixing aneurysms was with a big incision. Patients are in the intensive care unit for 2 or 3 days. They're in the hospital for 5 to 7 days. So that stress on an older patient is significant.
This is the first time that I have felt a little bit nervous.
Your anatomy is conducive to fix it with a minimally invasive stent graft. So the stent graft is going to go to there. So all your blood flow goes inside this tube and not into these 2 aneurysms.
Right. It's very good news that I am able to be a candidate for stent surgery. If you tell me that it's time.
I think you'll do fine with the treatment.
How confident are you?
In your case, we'll seal 98%.
Thank you very much.
You're welcome.
You know I trust you with my life.
We'll take good care of you.
I know you will. Every now and then, you think of where you might be if one of them burst.
And what's Dr. Taramani doing for you today?
2 aneurysm stents. You don't whine. You know, you overcome. That's the way I was raised.
Okay, you can put this lovely hat on your head here.
Thanks. Hello.
Did you get some sleep last night?
Yeah, I can't wait for this to be over.
Excellent.
Unfortunately, I bet Dr. Taramani that mine would burst before he would operate on me. You remember our bet?
What was our bet?
They were going to burst before you operated on me?
So then you owe me money.
Maybe you'd be a gentleman and not accept.
You're a tough one.
I know.
I'll see you back there, okay?
But you love me, right?
I love you a lot.
Right.
Okay.
Okay.
See you later.
Bye.
The stent is pre-manufactured into a delivery system.
And you're going to go to sleep in a few seconds here.
The first thing we do is we make 2 small growing incisions.
You have a nice nap, Betty.
We advance the delivery system up into the top part of the aneurysm. Ready to roll?
We're ready.
Let's see the main device. We land the stent right below the kidney arteries, and it has the precise ability to land exactly where you want it.
You like that, Mark?
Yeah. So you'll see the stent expanding there. Now, there's a stent covering the aneurysm here. You like to see that first stent come open? Yeah. Open it up a little bit more.
This is where you get your seal.
More respiration.
Holding.
I think that might be good. That might be the ticket right there. I like it up top. I like it down low. All right, bring lights back on. Call out to the family, let the daughter know everything's going fine. Right? Should be able to go home tomorrow. She'll be able to walk out of the hospital. And then, you know, slowly go back to resuming activity, but no more time bombs. So mom's doing great. No bandages, so she'll just have 2 little incisions.
That's great.
We did your surgery on the 2nd of August.
Right.
And now we're about 23 days later.
I don't have to worry about anything bursting.
Now your aneurysm in the abdominal aorta is sealed, common iliac is sealed. The chance of either of these 2 aneurysms rupturing is basically 0%.
Great.
So that's good news. The bad news is you lost the bet.
I know. Thank you so much.
You're welcome.
My girlfriend and I are planning to go to Paris in the spring. I've never been to Paris. Au revoir.
A couple weeks ago, my son told me, Mom, since your eyes are yellow, do you cry yellow tears? And my mom's like, you do, because I guess I was crying and my mom wiped them and they're yellow tears.
Jennifer was born with a genetic defect in her liver, alpha-1 antitrypsin deficiency. Hey, Jennifer, how are you?
I was diagnosed 6 years ago. They told me I had a terminal illness.
The liver produces certain proteins to protect our body. In her case, the liver is not producing these proteins. She developed end stage of liver injury. How's the pain? The patient's body cannot tolerate that degree of liver dysfunction, and the patient ends up dying.
I have so much gratitude to him. Every time that I've been so close to death, he's pulled me out.
When the swelling gets down, you know, the healing gets better. When the liver is not working, the body swells.
My mom's been sick since I was in 3rd grade. I remember the day she got diagnosed, We have a joke that my mom comes to visit home. She doesn't visit the hospital.
You look beautiful as ever.
Thank you. There's been a couple times where my grandma thought it was the end, that it was all going to end.
The liver has the capability of regenerating. In her case, the problem is even the new cells have the same genetic defect.
Prognosis is you live about 5-6 years. I really don't know what it is to be normal, not to have pain or nausea.
A new liver would fix the problem.
She's in need of a transplant, and we all pray and hope for her every day that she gets that in time.
We have this new treatment, albumin dialysis. They call it MARS, Molecular Adsorbent Recirculating System. Now we can remove a lot of the toxins that the liver should be removing.
Hi, Jen.
MARS can buy them time till they get their transplant.
Maybe I'll get my mom back like normal, the way she was before she got really sick.
A healing environment is not only giving medicines or doing procedures. It is all aspects of patients' well-being, nutrition, mobility, and improving the environment around them, make them less anxious.
My grandma calls him a big teddy bear because he's so sweet, but he's still like manly.
We incorporate a lot of different therapies, such as music therapy, aromatherapy, massage therapy.
We're not just taking care of a single patient, we're taking care of that patient and their family, their parents, their children, because the whole family is affected by what we do here for that one patient. The outcome will change the course of their life.
We've shared a lot of her ups and downs with her, the nurses and all the staff. We've seen her at her worst, and really her attitude and her spirit is a gift to us.
At no time do I feel sorry for myself. I can either let this get me down or I can continue with my life.
She's fighting her disease, and our commitment to her is to get her to the transplant. When she got the transplant, her daughter was the happiest person on earth. How are you? Look at this.
I didn't know you could turn her into a beautiful young woman again.
She looks great.
You do her hair too?
The liver is perfect. The liver is working very well.
I miss you so much.
Getting our patients to do well is the most satisfying thing in our career.
Hi.
Oh, I didn't even recognize you. Oh my gosh. Can I have a hug?
Yeah.
You look great.
You know, you went through a long phase of being sick. Now it's a new life.
I'm finally getting to a point where I'm gonna be able to be a mom again. Like today she has my shoes on, and I was like, Elizabeth, are those my shoes?
She weighs less than me now, and she's looked in my closet a couple times, and I'm like, no.
When I pick up a slide at 8 in the morning and I put it under the microscope and it's malignant, there's an entire life story. This patient had a lump in her breast, and this biopsy was done to determine if this was breast cancer. Even though patients don't see me, I'm absolutely one of their doctors. Being the person that actually makes the diagnosis and looks at the tissue, I'm probably best equipped to answer questions.
The specimen consists of a single fragment of tan-red tissue. So I want you to look at your pathology reports. T stands for tumor. And I want you to find the size of your tumor.
Dr. Bakhtar had the idea of Meet the Pathologist to help the patient who's already been told about their diagnosis further understand it.
Really what we're trying to do today is to give you an understanding of what disease you have so that you can ask questions.
Acknowledging someone's fears is putting yourself in their shoes.
The things that people don't know are usually the scariest.
Did they remove the entire breast?
No, not the entire, only a part. But still, is it the danger of spreading?
For me, things changed about a year ago. My wife was diagnosed with breast cancer, and I remember looking at the slide myself and my heart dropping. I said, it's cancer. And I remember my voice was quivering. I'll never forget that experience. And I can tell you, every time I look at breast cancer now, my heart drops in the same way. My wife had breast cancer in the 8th month of her pregnancy with our little guy who's 18 months now. And so I can appreciate what you all go through. Their mothers, their fathers, their sons and daughters, their wives, like my wife. My wife is doing extremely well. She's finished her therapy, is back to work, and life is good.
No estamos informadas y no entendemos qué está pasando en el cuerpo.
Yeah, she said she wanted to say thanks for doing this, that she says she thinks that women are going through all of this and not knowing what they're doing.
The moment of diagnosis can be a devastating moment, but once patients are informed, they feel empowered.
256, water broke. Enrique, get ready, let's get going. So here we are.
I'm dilated almost to a 3. I feel another contraction coming. I can feel right here hard.
We looked at our spinal cord injured population of males and realized that hardly any of them were becoming fathers after their injury.
Top one is her heartbeat. Wow.
We think that's an important part of life, and so we started a program.
I first met Enrique and Bertha in 1995.
Good to see you.
We were starting up this program and presented the idea to them, and they got really excited for the possibility of becoming parents.
I always saw myself as a family man. We get married, have kids, have a house.
It didn't ever cross my mind that I would date anybody in a wheelchair, no. It just happened. We had that bond.
I've been on the chair for, I want to say 29 years.
He's a true gentleman. He'll open the door for a lady. He doesn't let anybody open the door for him. Everything that I could ever ask, he's got it.
We were happy together, but there was something missing in our lives. And that was kids.
Enrique, I'm Tommy Lynn. Wonderful to meet you. So a little earlier than expected, huh?
Yes, it is.
Enrique had been a patient of mine for several years before we started trying to help them with fertility issues. Fertility levels fall as time elapses after spinal cord injuries.
It's not always just the male that has the issues with fertility.
Carmen, we're at the hospital. Everything's okay, so don't worry. What a morning.
We were figuring out how to get genetic material from Enrique, also how to properly implant Bertha. It took 13 years of increasingly complex reproductive therapies before they had their first child.
It was a miracle. We got Ivan. We got Ivan. Bye-bye. Yeah. This is big brother right here. Huh? Yeah. Mommy?
When Enrique was injured, his parents probably thought they'd never be grandparents, and they are.
And is this a boy or girl?
This is a girl.
That's perfect. Everybody wants a boy and then a girl. Perfect.
Another one is just more than we could ever ask for.
You have a contraction now?
Mm-hmm.
Oh, it's a strong one.
Mm-hmm.
She was actually originally scheduled for induction, but she came in because she ruptured. Husband is paraplegic, so in vitro is how they conceive.
These are embryos. These are 4 individual embryos, and then we grow them for up to 5 days in the laboratory. This is what's called a blastocyst. It has placental cells already, and this is later on day 5. It actually hatches out of its shell, and then we check a pregnancy test. That's our big day.
I have a little smile on my face, and I tell different people, okay, pray today, this is their baby making day.
Focusing on the end result will get you there. Just thinking about what you're going to have at the end in your arms.
It does take a village to raise a child. Probably in the birth of these children, at least 35 to 40 people are involved in all the steps along the way.
With our spinal cord couples, they have joked in the past, there's a lot of people in our bed helping us to make a baby.
Come on, sister. I had a 3-wheeler accident. Ended up with a complete spinal cord injury, a T10 and 11. It's just like it was yesterday. I was 21.
One of the typical situations with a fairly high spinal cord injury is that it affects the ability to get sperm out of the body. The most high-tech approach is where we actually go into the male's body and retrieve sperm surgically.
We're just gonna give you a little bit of Pitocin to kind of help make your contractions a little bit closer together.
Here at Mary Birch, we deliver over 8,500 babies a year. The work that we do here is really special. Sometimes all she wants is her mom or her sister to just stand there and hold her hand. You know, we do that for them as well, but it's different when you have your mom. She said she wanted you, her mom, and her aunt in the room for the delivery. She is complete and +1 to +2. She said she didn't push along with her first baby. Are you excited? Yeah. Yeah. It's very cool watching the dad. That's one of the first things I do once the baby is born is to look at the expression on his face.
We're ready to go. Bertha, when you have your contraction next, we'll tell you when to push.
So when you feel that pressure, you let us know, okay? Oh, just having a contraction. You're having a contraction. You ready to push?
Go for it.
Deep breath in and push. 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 Good. 2, 3, 4. Push. 2, 3, 4.
Good. First, take a deep cleansing breath. When you're ready, push with all your might. 3, 4, 5, 6, 7, 8, 9, 10. Good.
You're right back at it. Baby's right there.
Oh, push, 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 push.
Oh my God! Congratulations! Clean out the gurgling. Happy birthday! Happy birthday! You ready to cut the cord, Dad?
So that Enrique can cut. Good job.
And she sounds awesome. Congratulations. She's beautiful.
So what's her name? Emma Victoria.
Emma, my choice. Victoria, her choice.
Háblale, Susan.
Hi, Emma Victoria. Hi, baby. Welcome.
A full life is possible after spinal cord injury. A full life.
It's really a given that we're going to treat people with the newest and best equipment. We all understand that, but what we're bringing to that bedside that's different and unique is how much we care about them, how much we're hoping for their well-being.
Patients know when you care. It's an entire manner that you approach a patient with, doing what you need to do to support a patient medically and emotionally.
Everything we do has an impact on these people's life. They remember that nurse that touched them. They remember that someone put their arm through theirs and helped them walk down the hall. The kind words in the middle of the night. All those little things, all those simple acts of kindness and love are the things that matter. And that's the way healthcare should be.
The Sharp experience begins when you choose a physician at 1-800-82-SHARP or sharp.com.